Thanks, Speaker. Speaker, my question is to the Premier. Speaker, 1 year ago, hundreds of patients who travelled here from across the province watched the Liberal government strike down a PC motion sufferers had counted on to create a select committee on rare disease treatment. They are here again today, Speaker, 1 year after the Liberal government announced its own rare disease working group that would, quote, now begin taking concrete action. Speaker, it's been a year. What concrete action has the government taken?
Thank you. Premier.
Thank you very much, Mr. Speaker. And I just want to say that we know that many Ontarians have family members who are struggling with a rare disease or disorder, and our hearts go out to them, Mr. Speaker. But because these diseases are very rare, often they are misdiagnosed, Mr. Speaker, and I'm very pleased that we've been able to move ahead. Just yesterday, Minister Hoskins announced an expansion to clinics for those needing specialized care. There's also, as the member knows, there's a working group of experts that is in place who can explore how services for people with rare diseases can be improved in Ontario, Mr. Speaker. These are very challenging, very specific situations, Mr. Speaker, and we need to have experts who give us ongoing advice. In the interim, the Minister has announced an increase to support for clinics, Mr. Speaker.
Thank you. Supplementary.
Thanks, Speaker. Speaker, while we were happy, of course, to see EDS sufferers who were forced to come to Queen's Park last year get their clinic, the fact is that they had to travel to the legislature in failing health before the minister or your government would do anything. In fact, it seems this Liberal government only acts for Ontarians after they've been forced to come to Queen's Park to beg for life-saving support, and the cameras are on. While it may have been politically expedient to finally support EDS once the cameras switched off, so did the hopes for hundreds of thousands of other sufferers with cystic fibrosis, Cattleman's disease, PKU, AHUS, or a host of other rare diseases. Speaker, it's Rare Disease Day. The cameras are back on. Will the Premier report where and what is the strategy to help Ontarians suffering from all rare diseases?
Good question. Thank you. Premier.
Long-term care.
Minister of Long-Term Care.
Well, thank you, Mr. Speaker. And as much as the member opposite might want to try to make this political or try to make it partisan, it's been the better part of 2 years, Mr. Speaker. In fact, this Premier led the charge nationally for the creation of a working group on rare diseases, long before the member opposite raised this in the legislature. But importantly, Mr. Speaker, we did hear from patients with EDS, with Ehlers-Danlos syndrome, and thanks to their important advocacy and the advocacy of the group that often represents them, ILC Canada, we were able to create a task force which included patients and patient advocates on it, an expert task force and panel that actually led to the creation of the announcement I made yesterday, which was funding of $1 million ongoing for a partnership between University Health Network and Sick Kids to actually provide specialized care specifically for children and adults with EDS, Mr. Speaker. I'm proud of that decision.
That's right. Supplementary.
Speaker, this minister has had the Ontario Citizens Council report on rare disease strategy since 2010 and has done nothing with it. He told us last spring we would have working group recommendations within 3 months. We're knee-deep in empty words. What we need is action. If he has the report, he should actually table it today. Speaker, when it comes down to governing, it's all about choices and priorities. Choices to strike down an all-party, open, transparent rare disease select committee in favour of a behind-the-doors working group, prioritizing to spend what's left of our tax dollars on the matters that will best impact the lives of all Ontarians, unlike relocating gas plants. Speaker, will the Premier tell us why, when it came to a choice between subsidizing a $140,000 Tesla owner with massive rebates versus spending to treat rare disease, she went with a new car?
Thank you. Minister.
Well, Mr. Speaker, we decided instead of having politicians make these decisions in the form of a select committee, we knew from advocates, from patients, from scientists, from academics, from clinicians, we knew many of the steps that needed to be taken. So we created a working group, quite frankly, comprised of those experts, Mr. Speaker, a working group on rare diseases. I have not received the final report. I'm expecting to receive it in the coming several weeks. But a working group which is chaired by Dr. Ronald Cohn, a pediatrician-in-chief from the Hospital for Sick Children, Scott McIntyre, who's the Senior Vice President of the University Health Network, Crystal Chin, a patient, Guida Cloza, a patient caregiver, Dr. Richard Ward, a physician lead at UHN in blood disorders programs, Dr. Pranesh Chakraborty, Director of Newborn Screening Ontario, the exact and precise people who should be providing that advice to the government. They're doing that. I'll be receiving it in the next several weeks, Mr. Speaker.